Hello everyone, we are the next group and we're here to report Module 15 and 16. Module 15 include muscle of the head, face, tongue, pharynx, and larynx. And I'm Clary Joy Baso. I'll be discussing the muscles of the head. The first one, we have longus capitis. This is a sizable band of tissue that stretches from the cervical vertebrae. This is also known as the section of the vertebra nearest the skull to the bottom of the skull. This muscle is located anterior to longus colli. The next one, we have rectus capitis ventralis. This is the ventral straight muscle of the head. This muscle is located behind the upper part of the longus capitis. Rectus capitis lateralis. This is a small paired muscle that is found within the neck, deep to the prevertebral part of the deep cervical fascia. This one is located lateral to the rectus capitis posterior minor. Rectus capitis dorsalis major. This is the larger posterior straight muscle of the head. Rectus capitis dorsalis minor. This is the lesser posterior straight muscle of the head. Obliquus capitis caudalis. This attaches laterally to the atlas wings and extends cranially to the spinous process of the axis. This is one of the main muscles allowing rotation of the atlantoaxial joint. The next muscle, we have the muscles of the face. The first one is orbicularis oris. It surrounds the mouth, lying in the upper and lower lips. Incisivus maxillaris and incisivus mandibularis. The incisivus maxillaris is the incisive fossa of the maxilla, while incisivus mandibularis is the bony canal within the anterior mandible that runs bilaterally from the mental foramina, usually to the region of the ipsilateral lateral incisor teeth. Levator labii maxillaris is a facial muscle arising from the lower margin of the orbit and inserting into the muscular substance of the upper lip, which it elevates. Caninus is a facial muscle of the mouth arising from the canine fossa immediately below the infraorbital foramen.
Good day everyone, I am Julie Villacarlos, and to start with my part, the first one is the vaccinator muscle. When we say vaccinator muscle, it is a facial muscle that contributes to producing facial expressions and mastication. This is located within the cheek and spread parallel to the great axis of the mouth, of which it closes the cavity laterally. The vaccinator muscle runs from the corner of the mouth to the jaw, and its name implies trumpeter. Thus, the cheeks will be compressed. When you think about playing the trumpet, for example, and you do it badly or you do it poorly, your cheeks have a tendency to blow out like yung chipmunk. But when you do it right, the vaccinator muscle compresses the cheeks and drives the air out through the mouth. Next is the mentalis. The mentalis is a muscle that provides stability to the lower lip to allow it to pout. The mentalis is a division of the vaccinator's ventral portion. Mentalis muscle help us to do pout or yung pouting. The lower lip is raised and protruded with the help of this muscle. The mandible, also known as yung incisive fossa, is the point of origin, while yung chin skin naman serves as the point of insertion. Next is the malaris. The rostral fascia of the lower eyelid is spread as a thin muscle to insert on the ventral orbicularis oculi muscle and functions to depress the lower eyelid. The malaris in dog originates at the bottom of the jaw's midline and extends upward to the lower eyelid. Next is the zygomaticus muscle. One of the face muscle that aids in the movement of our lips is the zygomaticus. Animal face expressions are also greatly influenced by this muscle. Many people consider the zygomaticus muscle as the basic smile muscle, particularly the zygomaticus major. When we say zygomaticus major, it is a small or thin-paired facial muscle that runs diagonally from the zygomatic arc or yung zygomatic bone to the angle of the mouth. Zygomaticus major origin is on the zygomatic bone, insertion on the skin at the corner of the lips, and we get an elevation of the corner of the lips. For example, your boyfriend or your girlfriend saw you, or your crush na lang saw you, and then he or she sabi niya, "Oh, you're so cute," and then you feel kilig, and sabi mo na, "You make my zygomaticus muscle contract," or to simply put, "You make me smile." Anyways, if we have zygomaticus major, we also have the zygomaticus minor. Zygomaticus minor is also origin in zygomatic bone or zygomatic arc that runs horizontally across the cheeks. Kanina, yung zygomaticus major is runs diagonally from the zygomatic arc. Yung zygomatic minor naman runs horizontally across the cheeks. The zygomaticus minor is a muscle that raises the upper lip, which expose naman yung maxillary teeth. Next is the orbicularis oculi. It is the major muscle responsible for eyelid closure. This muscle surrounds the eye, or more precisely yung eyelid. The portion of the word or yung word orbicularis indicates that the muscle is round or circular. Orb meaning kasi circle. Also, the word oculi means from the Latin word oculus, which means eye. So this muscle wraps around the whole eye. Orbicularis oculi is a circular muscle that closes the eyelid like yung sphincter muscle. Next is the digastricus muscle. The digastricus or the biventor is the only muscle that opens the jaw. That's why it is responsible for the jaw opening. This muscle arises from the occipital bone's jugular process and inserts on the angle and ventral side of the jaw. Moving on is the muscles of the external ear. The rostral auricular muscles are divided into 4 groups, namely the rostral group, dorsal group, yung caudal group, and the ventral group. These muscles groups are connected to a flat L-shaped sesamoid cartilage located rostrodorsal to the external ear canal. The first one is the rostral auricular, which means it is the visible part of the ear that is outside the head. And this rostral group or rostral auricular consists of fronto-scutularis, scutulo-auricularis superficialis, scutulo-auricularis medialis, and scutulo-auricularis dorsalis. Next is the dorsal auricular, which is also a part of external ear muscle, and it comprises of occipitalis muscle, interscutularis muscle, interparaitoscutularis muscle, and interparieto auricularis muscle. The next one is the caudal auricular. It is an external ear muscle include the cervico-scutularis, cervio-auricularis superficial, and cervico-auricularis profundus. Next is the scutulo-auricularis superficialis and scutulo-auricularis profundi. Scutulo-auricularis superficialis are several muscles forming superficial group from cartilage scutiforms to concha auriculae, while the scutulo-auricularis profundi, major and minor muscles from ventral surface of cartilage scutiformis to eminentia conchae.
Good day, I am Lididan Mamaril. So the next muscle are frontoescutularis. So the temporal part arises from the zygomatic arc and the frontal part arises from the frontal crest. Both insert into the anterior border of the scutiform cartilage. This was a thin band of muscle with fibers of dog. Next is the zygomatico-scutularis, is a cheek shield muscle and a broader term for the anterior ear muscles. Next is zygomatico-auricularis, so is the anterior auricularis muscles, which band of muscle that runs generally from above the eye to and below the ear of dog. So next, the dorsal auricular muscles. First one is the interscutularis, which is a muscle that attaches to the base of the ear and to the middle of the skull. Next is the paretoescutularis, is an independent external ear muscle. And the last is the pareto-auricularis, also known as middle levator. Levator, in dogs, the eyebrow motion is made by a muscle above their eyes, which is on the inner side of their nose. Next is the caudal auricular muscle. First one is the cervico-scutularis. It is united with the deep surface of the interscutularis by means of a few fibers, which means dorsal median wrap of the neck of dog. Second is the cervico-auricularis superficialis. It is a long elevator muscle of the ear, which muscles are continuous. This means the ear may still exhibit some movement in case of the facial nerve. Next is the cervico-auricularis medius. So it turns the opening of the auricular cartilage caudolaterally. So the last is the cervico-auricularis profundus, consists of long and short lateral rotator or major and minor lateral rotator, which is the near base of the ear and terminates in the maxillary vein caudal to the termination of the superficial temporal vein of the dog. Next is the auricularis ventralis. First one is the stelo-auricularis. It is a tiny muscle that runs from the stellate process roots to the cartilage of the ear's meatus, which is the external meatus of the dog ear canal that forms the base of the auricle to the tympanic membrane. So, ear's meatus is slightly curved ventrally and cranially in a dog ear.
I'm Nicolay Jacobe. Muscle of the tongue. Tongue has 8 muscles. There is no supporting bone for the tongue muscles to grow around. Tongue muscle has the flexible muscular organ situated in floor of the oral cavity. Extrinsic muscle of the tongue. First one is styloglossus. A paired extrinsic tongue muscle is the styloglossus. It may be found in the canine tongue's caudal third. Go. The styloglossus is the shortest and smallest of the 3 styloid muscles, and also to lift the lateral edges and to retract the tongue. Next one is genioglossus. The genioglossus is the tongue midline muscles. It enters the tongue body and hyoid bone from the mandible. The genioglossus muscle is a fan-shaped muscle that involved in forming most of the tongue mass. And the last one is hyoglossus. The hyoglossus is a lateral extrinsic lingual muscle of the dog located at the base of the tongue and underneath the styloglossus muscle. The hyoglossus muscle develops from the ventrolateral surface.
The hyoglossus muscles originate on each side from the whole length of the greater cornua and also from the body of the hyoid. Intrinsic muscle of the tongue. First one is lingua propria. The hypoglossal nerve innervates the intrinsic propria lingua muscles, which pulls the tongue back and down. This nerve enables tongue movement. It controls the hypoglossus intrinsic, and also this muscle help you speak, swallow, and move substances around your mouth. Intrinsic muscle of pharynx. First one is hyopharyngus. Is an thickened fold on the floor of the mouth of many insects that resembles a tongue. Next one is ceratopharyngus. Chondropharyngus, the muscles that arise from the lesser cornu of the hyoid bone and forms part the pharynx middle constrictor. Next is thiopharyngus. The thiopharyngus muscles arise from trioid cartilage and attach to the pharyngeal in median pharyngeal. Next is cricopharyngus. Cricopharyngus muscles is the main muscular component of the upper esophageal, which is positioned at the intersection of pharynx and the esophagus. And the last one is palatopharyngus. Palatopharyngus muscle is the head and neck muscles that is also one of the pharyngeal inner longitudinal muscles. It is among the 5 soft palate paired muscles.
Hi, I'm Christian Jomar Plasigi. So, for today's video guys, ang aking i-discuss is the remaining parts of our report. It starts with the Stylopharyngeus caudalis. Is a long, slender, and tapering longitudinal pharyngeal muscle that operates during the pharyngeal phase of swallowing. It runs between the styloid process of the temporal bone and the throat. It acts as a significant nasopharyngeal dilating muscle. The contraction of this muscle pulls the nasopharyngeal wall dorsally during breathing. By supporting the dorsal wall of the nasopharynx during inspiration, this movement prevents the wall from constantly collapse. And then the next one is the tensor veli palatine. Is a flat fusiform muscle that, like the elevator, attaches the petrous part of the temporal bone, the pterygoid bones, and the lateral lamina of the guttural pouch. It tenses the soft palate and opens the eustachian tube. And then the next one is the levator veli palatine. Is one of the soft palatis 5 paired muscles. It's a cylindrical muscle or having a cylinder shape that connects behind and above the soft palate to produce a V-shaped sling. According to Moon and Cohen on 2004, the levator veli palatine or the levator muscle is thought to be the principal source of velar elevation. Its purpose is to raise the velum in order to close the gap between the oral and nasal chambers. Then the next one is the palatinus. It's a bony growth on the roof of the mouth is known as palatinus. This growth can be extremely little or rather huge, and they appear in a variety of shapes. It is not cancerous or harmful to have a palatinus. Then the next one is the cricothyroideus. Is a primary tensor of the vocal cords, a triangle muscle of the larynx linked to the cricoid and thyroid cartilages, also known as the cricothyroid muscle. It produces tension and elongation of the vocal cords as its function. Then the next one is the cricoarytenoid muscle is the cricoarytenoid muscle is the only muscle of the larynx that abducts the vocal cords and then therefore opens the rima glottidis. It is an antagonist muscle or parang main muscle to the lateral cricoarytenoid muscle, which acts is to protect the airway by closing the glottis. Its function or yung main function ng muscle na ito is pinoprotektahan niya yung airway by closing the glottis. Then the next one is that the thyroarytenoid muscle is a broad, thin muscle that forms the body of the vocal and that supports the wall of the ventricle and its appendix. And then ang function nito is to shorten the vocal folds. And then the next one is a muscle that is and then the next one is the vocalis. Vocalis is a small muscle that is the middle part of the thyroarytenoid. Its origins in the lamina of the thyroid cartilage. It inserts in the vocal process of the arytenoid cartilage and modulates the tension of the true vocal cords. The main function or action of the vocalis muscle is to adjust or alter the tension of small segments of the vocal folds in order to vary tonal qualities and pitches of the voice. The next one is the ventricularis. It's a small bundle of fibers of the thyroarytenoid that extends along the wall of the ventricle from the arytenoid cartilage to the epiglottis. It facilitates valve tissues movement by allowing extension and recall of the valve during the cardiac cycle as its function. And then the last one is the transverse arytenoid. Is an adductor of the vocal folds, thus playing an important role in phonetation, together with the lateral cricoarytenoids, oblique arytenoids, and aryepiglottic muscles. This muscle act as a sphincter or the laryngeal inlet preventing food or fluid from entering the lower respiratory tract.
Hi everyone, I'm Julie Villacarles again, and at this moment we are going to moving forward on to our next topic, which is the Module 16, long muscles of the head, neck, and back. The long muscles of the neck or trunk and back include the epictal or the epaxial. Epaxial lie dorsal to the transverse process of the vertebra. The role of epaxial muscles in dogs is to provide spine extension and lateral bending. It also to maintain spine posture, to oppose gravity and forces placed on the spine by the hind legs, and also to provide local and dynamic spine stabilization. Longus colli and longus capitis. Longus colli is the prevertebral muscle of the neck that is innervated by the anterior rami of C2 C6 from the cervical plexus, while the longus capitis is the muscle that acts to or that serves to flex the head. Next is the iliocostalis thoracis. The thoracic portion of the iliocostalis muscle or iliocostalis thoracis, also known as the iliocostalis dorsi, is a narrow, fusiform muscle that sits lateral to the iliocostalis cervicis. It comes from the superior aspect of the bottom 6 ribs angle from 6 to 12 ribs. It is also situated medial to the insertion of the ilicostalis lumborum. And when we say the ilicostalis lumborum muscle, it is the erector spinae's most inferior and lateral muscle. The ilicostalis lumborum muscle arises from the common root of the erector spinae muscles and proceeds superiorly to connect to the posterior and inferior surfaces of angles of the lower 6 to 9 ribs. The lateral branches of the posterior primary divisions of the lumbar and lower thoracic spinal nerves innervate this muscle, which stretches and laterally flexes the thoracolumbar spine. Moving on, when we say longissimus muscle, we are pertaining to not just one muscle but a collection of 3 separate muscles that run up nearly the entire length of both sides of the spinal column, from lower back up to the neck. These 3 muscles include yung longissimus capitis, longissimus cervicis, and yung longissimus thoracis. The first one is the longissimus thoracis. The erector spinae muscle's longest muscle is the longissimus thoracis. All the 12 thoracic vertebrae transverse processes are also attached to the longissimus thoracis muscle. When acting unilaterally, this muscle holds the thoracic and lumbar regions upright while also laterally flexing yung spine. The thoracic and lumbar posterior main divisions, lateral branches innervate it. Next is the longissimus cervicis. Between the longissimus capitis and longissimus thoracis is the longissimus cervicis, which is the muscle's middle section. The transverse processes of these first 5 thoracic vertebrae give rise to longissimus cervicis from T1 to T5. It rises between the longissimus capitis and longissimus thoracis before inserting at the posterior tubercle of the transverse processes of vertebrae.
Next is the longissimus capitis. It is a part of the longest muscle of the neck which serve to rotate the head from side to side and extend the head. So, parang sa tao din kaya naro-rotate din natin yung neck natin because of the longissimus capitis. Ganon din sa dog. So, the next is the splenius. It is around the side and back of the neck. They extend and laterally bend the neck and head and rotate head to the same side. The third is the semi-spinalis capitis. It is a long paired muscle that belongs to the deep layer of muscle of the back. It is also formed the superior and largest component of the 3-part of the semi-spinalis muscle. Last is the serratus dorsalis, cranialis, and caudalis. A thoracolumbar fascia and spine of the first 6 to 8 thoracic vertebra. Next is the hypaxial of the dog. It is include the muscle of the abdominal and thoracic walls. First one is the internal intercostal muscle. It is a fiber that runs from the cranial aspect of the tone rib to the caudal aspect of the preceding rib in a cranioventral direction, which is the perpendicular to the fibers of the external intercostal muscles.
Rectus thoracis is the first rib opposite the most ventral portion of the scalenus muscle. It also flexes the trunk anteriorly. Anteriorly, it means it flexes itself in front part. Yan. Yeah, I mean, it's a front part or piniflex niya yung nasa harapan niya or front part. Ganon. Yun ang meaning ng anterior. Meaning it's front part. Then the next one is the diaphragm. Diaphragm is located below the lungs. It's the major muscle of respiration. It is a large dome-shaped muscle. Dome shape is like kalahating bilog, or if nakakita na kayo ng roof ng isang mosque or mosque ba ang tawag basa doon, di ko alam, yung simbahan ng mga Muslims, yun, ganun yun, oo. It contracts typically and continually, and most of the time involuntarily. Upon inhalation, the diaphragm contracts and flutters, and the chest cavity enlarges. Habang nag-inhale ka or nag-breath in ka, yung diaphragm mo is parang nai-squeeze siya or lumiliit, while yung chest mo is lumalaki siya, parang nag-enlarge yun, nag-enlarge. The diaphragm is a muscle that helps you inhale and exhale, or breath in and breath out. And then the next one is the external abdominal oblique. Is the largest and the most superficial of the lateral abdominal muscles. It lies beneath the thoracic and abdominal skin, covering the internal abdominal oblique and anterior halves of the ribs and intercostal muscles. Its muscular part contributes to the lateral part of the abdominal wall. The external oblique muscle flexes the trunk, and also it assists expiration by depressing the ribs, and assists to maintain intra-abdominal pressure in evacuation of luminal contents, and support intra-abdominal viscera as its function. And then the next one is the internal abdominal oblique. Is a muscle found on the lateral side of the abdomen. Lateral side, it means sa gilid. It is the broad and thin. It is broad and thin. It forms one of the layers of the lateral abdominal wall along the external oblique on the outer side, and transverse abdominis on the inner side. The internal oblique muscles flexes and bends the trunk, assist forced expiration by depressing the lower ribs, and helps to maintain an intra-abdominal pressure in defecation, micturition, and childbirth as its function. And then the next one is the transversus abdominis, also known as transverse abdominis. Is the deepest layer of abdominal muscle. It sits below the internal and external obliques and rectus abdominis, and spans from the lower ribs from 7 to 12 ribs down to the pelvis, along with other core muscles. The main role of the transverse abdominis are to protect the internal organs. It can be the royal guard of your internal organs, by holding them in a proper place, and to support the torso by maintaining abdominal wall tension, which stabilizes the spine and pelvis before any movement of the limbs can occur.
Rectus abdominis, a long flat muscles that extend along the whole length of the both sides of the abdomen. Rectus abdominis runs along the ventral aspect of the body wall between the pectoral and pelvic girdles. And laterally, this muscles is associated with the third group, the lateral facial muscles. Serratus ventralis is a muscles in forelimb which covers a large area over the shoulder blade, coming up into the neck and down into the ribs. The serratus ventralis is composed of cervical and thoracic portions that originate from the cervical vertebrae.
Muscles of the tail. Sacrocaudales dorsalis lateralis, a lateral intervertebral connecting system, and a ventral sacrocaudal system. Sacrocaudales dorsalis medialis. This muscle is located above the tail head on either side of the dorsal spinous process of the sacrococcygeal vertebra.
Sacrocaudalis ventralis lateralis This is a ventral surface of the body of the last lumbar vertebra and from the sacrum. Sacrocaudalis ventralis medialis, starting from the last sacral vertebra on the ventral surface and running from each vertebra to the next. Intertransversary caudae are small muscles placed between the transverse processes of the vertebrae. Coccygeus, it supports the pelvic viscera and weakly aids the puborectales to control urination and defecation, especially when there is an increase in intra-abdominal pressure. And lastly, we have rectococcygeus, are two bands of smooth muscle tissue that are rising from the second and third coccygeal vertebrae, it passing downward and forward to blend with the rectal longitudinal smooth muscle fibers and the posterior wall of the anal canal. And that's it. Thank you for listening. If you have question, you can ask us reporters and we will answer it one by one. That's it. Good day.